We have today women complains of fever after delivery. After shaking the hand of the patient and make a good relationship in order to start to take the information from the patient, we will start to ask the patient about what is your name and how old are you, and then what is the nationality, and what is the social status, married, divorced, widow, and what is the pregnancy outcomes, and if she was using method of contraception before, and what is the blood group, and what is the RH typing. And what is the occupation. And what is address, and what is habits, smoker, alcohol, addict, narcotics, non-narcotics, if she is smoking or not, if she's smoking, how many cigarettes she's smoking per day, and for how many years she's smoking. The main problem of the patient is that she has a fever after delivery. When this fever starts on the first day or second day, third or fourth day, after fifth day, after 10 days or later on, we ask about the sequence of what happens on delivery, membranes ruptured before delivery or as onset of labor, or less than 24 hours before onset of labor, or more than 12 hours before onset of labor. The place of delivery is home, clinic, or hospital. So we will ask about the place of delivery. It is a home or clinic or hospital. Any problem, spontaneous vaginal delivery, or complicated vaginal delivery, or forceps delivery, ventouse, liver emergency cesarean section, or elective cesarean section. Any problem happens during labor, prolonged labor, shoulder dystocia, retained placenta, retained parts of the membranes of placenta, manual removal of placenta, atonic postpartum hemorrhage, exploration of the genital tract after postpartum hemorrhage, intrauterine balloon to control postpartum hemorrhage, laparotomy after postpartum hemorrhage, hysterectomy for as treatment for intractable postpartum hemorrhage after vaginal delivery, hysterectomy after cesarean section, suture of cervical laceration, suture of vaginal or perineal laceration, suture of extended episiotomy, repair of complete perineal tear. Whether catheter was inserted to evacuate the bladder, no urinary catheter inserted, catheter inserted during cesarean section and removed after the end of the operation, catheter inserted before cesarean section and left for 6 hours, catheter inserted before cesarean section and left for up to 24 hours, catheter inserted after vaginal delivery because of retention of urine. And then we ask about when the fever starts and the type of the fever. Intermittent fever is elevated but falls to normal each day, or intermittent fever, the temperature falls each day but not to normal. Continuous or sustained fever, hectic fever, or lapsing fever. There's rigors, nodules, or reports of shivering and shaking associated with rapid change of the body temperature. There's sweating or no sweating, reports of nocturnal sweating that result from an exaggeration of the normal circadian temperature rhythm. Do you feel fatigue and exhaustions? Do you change of the normal appetite, anorexia, or eating normal? she is no breastfeeding or start breastfeeding after delivery or start breastfeeding on the second day after delivery or empties breast of milk as the newborn is in the incubator. No breastfeeding, irregular breastfeeding or difficult breastfeeding, fissures of the nipple. There is no breast pain, diffuse pain on one breast or localized dull aching pain in one quadrant of the breast or throbbing pain in localized area of the breast. One breast is swollen or one breast has localized painful swelling. And then we shift for abdominal pain. She has abdominal pain or no pain. If she has pain, when the pain starts, on the first day after delivery, on second day after delivery, on third day after delivery, after fourth day or after seventh day after delivery, the site of the pain, over the abdomen below level umbilicus, or severe abdominal pain marked on one of the iliac fossa, or severe abdominal pain on both iliac fossa, or she has generalized abdominal pain, or she has lower deep abdominal pain with dyschezia and tenesmus with passage of loose mucus with watery stool, diffuse pain over cesarean section scar, or throbbing pain over cesarean section wound. If she has cesarean section wound, dry wound, or bloody discharge, or purulent discharge from the wound and painful, and what are the type of the pain? The pain is dull aching pain, or colic abdominal pain, or throbbing pain. She has nausea or vomiting. She has no nausea, or she has vomiting once, vomiting twice, or continuous repeated vomiting. If she has episiotomy, she has pain at the site of the episiotomy, no pain at the site of perineum, dull aching pain in the episiotomy wound, or throbbing pain in the episiotomy wound. There is any discharge coming from this episiotomy wound, no discharge, purulent discharge from the episiotomy wound, or serous discharge from the episiotomy wound. We ask about the vaginal discharge. Lochia is rubra or serosa or lochia alba or offensive lochia. And the normal amount of discharge, scanty offensive discharge or copious vaginal discharge. We ask about the urinary symptoms. There is change in the frequency, increased frequency or normal frequency. Marked increased frequency more than 5 times per day and more than 2 per night. There is burning and dysuria and burn. There is normal continence or urgency incontinence or stress urinary incontinence. She has pain on right side or line, or no pain on the left line, or no pain on both line, or no pain on line. Ask about if there is any pain or discomfort in the throat, no pain in the pharynx, pain in the pharynx and pain during swallowing. There is cough or no cough, dry cough, productive cough, yellow green sputum, productive cough, white sputum. She has chest pain, not chest pain on one side during deep breathing, chest pain on both sides during breathing, chest pain all the time, breathing increase with inspiration. Do you notice any leg swelling? No leg swelling. There is leg swelling after several days, and there is pain or discomfort on the leg, no swelling of both leg, swelling of one leg. She has diabetes or no? She has no diabetes, gestational diabetes, controlled adult onset diabetes, controlled juvenile diabetes, uncontrolled diabetes. What is the blood glucose level? it is less than 120 milligram per deciliter, or 120 or more than 140 milligram per deciliter. She has heart disease or not? No heart disease, rheumatic heart disease, mitral valve disease, or congenital heart disease. Past history of anemia, moderate anemia or severe anemia, and we thank the patient. Then, from the history, we can suspect the site of the fever is either related to the abdomen or the breast or the chest or the throat or the legs. So we will examine the patient's general condition of the patient. The patient is fair, toxic, exhausted, dyspneic, lapsed, drowsy, semi-conscious, or comatose. And the patient weighs, and there is pallor or no pallor, there is jaundice or no jaundice, there is cyanosis or no cyanosis, and the temperature, what is about the temperature, is more than 37.8 or less than this, and pulse rate. And it is very important to correlate the pulse rate to the temperature. Normally, if there is increase or more than 10 per 1 centigrade, we should look that the patient is anemic, or there may be problem of deep venous thrombosis. The blood pressure is normotensive or shock, and the respiratory rate is normal, or there's tachypnea. And we should look for the mouth. There's any congestion of the mouth or inflamed tonsils. We look for the veins, the normal thyroid or single thyroid. We look for the neck veins, and we look for this submandibular or cervical lymph node enlargement. We look for the breast. Nipple is normal to retracted nipple. The breast tissue is soft, breast tissue, congested, swollen, red, painful, or congested, swollen, and left breast, or congested, tender, swollen on the right breast, or localized tender swelling on left breast, or diffuse swelling, tender left breast, or diffuse swelling of the right breast. And we look for the chest and heart, normal heart or congenital heart lesions, congenital mitral valve collapse, rheumatic heart mitral valve stenosis, rheumatic heart mitral valve regurg, or rheumatic heart mitral valve regurg and aortic stenosis, mitral heart and aortic stenosis, mitral valve replacement, mitral and aortic valve replacement, congested heart failure, pulmonary hypertension, and we will see that there is normal lung or generalized lung wheezes, or diffuse lung wheezes, or localized lung crepitation, or diffuse lung crepitation, diffuse lung wheezing and crepitation, lung crepitation and the wheezing pleural rub on right lung, crepitation and the wheezing and pleural rub of left lung, crepitation and the wheezes and pleural rub on both lungs. We look for the legs, and the legs are edematous or not edematous. There's no varicose vein, or there is superficial varicose vein post-ling or support, or leg is swollen and painful, or leg is swollen and painless. And then we look for the abdomen. We look for the abdominal distension and enlargement, uterine enlargement. Then if there is cesarean section wound, there is soft and painless or diffuse redness and tender wound, or localized tender red wound, or wound oozes blood, or wound oozes pus. And then we start to palpate the abdomen. We see that the uterus is midway between symphysis pubis and umbilicus painless, or uterus is enlarged between umbilicus, or uterus below the umbilicus and painless, uterus is above symphysis pubis and painless, uterus is not felt per abdomen, or uterus painful, and we look for the uterus. The uterus is painless midway between the symphysis pubis and the umbilicus, or uterus is enlarged reaching the umbilicus and painless, and uterus below umbilicus and painless, uterus above the symphysis pubis and painless, or the uterus is net felt per abdomen, uterus is painful midway between umbilicus and symphysis pubis, or uterus is painful and reaching the level of umbilicus. We shifted for lateral side, no tenderness on rigidity in post iliac fossa, or localized tenderness on left iliac fossa, or there is localized tenderness and rigidity and swelling on left iliac fossa, or localized tenderness on the right iliac fossa, or localized tenderness and rigidity and swelling on the right iliac fossa, and tenderness and rigidity in post iliac fossa, or generalized tenderness and mild rigidity over the abdomen. The abdomen is soft and lax, or generalized distended abdomen, or generalized tender distended abdomen. The liver and spleen is normal, or there is enlarged liver and spleen. And we palpate the loin, no pain on post loin, or pain on left loin region, or pain on right loin region, or pain on post loin region. We auscultate the abdomen sinus sound, normal sinus sound, or sluggish sinus sound, or absent sinus sound, or excessive loud sinus sound. Then we do vaginal examination. We look for the discharge. The discharge is leukorrhea, or frank blood, or cubious offensive discharge, or scanty offensive discharge, or leukia serosa, or leukia alba. And we inspect the perineum, normal, or there's perineal tear, or episiotomy is healing, healthy and healing, or the tenderness and discharge from the episiotomy wound, if there's a episiotomy wound. And we do vaginal examinations, cervix is closed, or cervix open, or pain on moving the cervix. The cervix boogie mass and Douglas pouch, we look for the Douglas pouch or normal Douglas pouch. Then we examine the uterus. The uterus is normal, soft, enlarged mobile, or tender enlarged mobile uterus, or tender involuted mobile uterus, or tender fixed involuted uterus. The adnexa is, both adnexa are not palpable, or tenderness on right adnexa, or tender swollen right adnexa, or tender left adnexa, or tender swollen left adnexa, tenderness on post adnexa, or swollen tender post adnexa. And do rectal examination, normal, or there is hemorrhoid, or tender parametrium, or tender swollen parametrium. So at the end of the examination, we can determine that the cause of the fever is either wound infection, or puerperal sepsis, or generalized peritonitis, or tubal ovarian problem, or breast problems, whether breast engorgement, or breast abscess, or the deep venous thrombosis, or the cause or urinary tract infection, or the cause of the fever is in the pharynx, pharyngitis, or tonsillitis, or chest infection, or the cause of the fever is another problem of fever not related to the liver. And